Today's episode is brought to you by Microsoft Dragon Copilot, your AI assistant for clinical workflow. Learn how Dragon Copilot can transform the way you work. Stick around after the episode or visit aka.ms/knock-knock-hi. Again, that's aka.ms/knock-knock-hi.
Knock, knock, hi.
Merry Christmas, everybody! Welcome to Knock Knock Hi with the Glaucomfleckens. I'm Dr. Glaucomflecken, also known as Will Flannery.
I'm Lady Glaucomflecken, also known as Kristin Flannery.
If you're watching us on YouTube, you'll notice that Kristin is wearing a periodic table themed Christmas tree shirt.
That's right.
And so it is that time of year.
I bring this out every Christmas.
What's your favorite? All right, you have to choose a favorite Christmas carol. What is it? You can only hear one Christmas carol, one Christmas song for the rest of your life.
Oh!
Not only can you only hear that one, but you have to listen to that one every year for like.
Isn't that already the case?
No, but you have some options. There's different ones.
Okay. Well, the two that came to mind were Jingle Bells, just because that's like the ubiquitous Christmas carol.
Sure.
But also Carol of the Bells, because that one's pretty.
Yeah, I think I would want something that's a little bit slower and not as poppy and like
takes longer to get annoyed with it.
Yeah, it's just less in your face than Jingle Bells. I don't know. Let's talk about working around Christmas.
All right.
A lot of healthcare people do that.
They do.
I always appreciate the clinics and hospitals that put a lot of decorations up.
Yeah.
Isn't that nice?
Yes, especially it's probably nice for the people working, but also the patients. Like, who wants to be in the hospital on Christmas?
And you have like special Christmas meal things.
Yeah.
And
like acknowledging
something better than just brown meal.
Yeah.
This is what we called the hospital meal that you would get. Whenever I was working at the VA, you would get, when you were on call at the VA, you got one like free meal at the cafeteria overnight. Well, but you could get it at like any time. Like you could show up at like 2 a.m. and like you'd just go and get your meal, and we called it brown meal.
Yeah.
Because it was brown. That was every part about it. Even the tray was brown.
Oh boy.
Yeah, it was just one color, just brown. It was some kind of potato with brown gravy. It was usually like a turkey.
Sure.
Brownish, turkey there. You had like a second potato, like fries.
Maybe a roll.
Or a roll. Yeah, definitely a roll. You couldn't really count on vegetables.
Are there any brown vegetables?
There was maybe like a piece of cake that was also brown. It's like a chocolate cake, something. I don't know. It was just all brown. Very little color. So anyway, hopefully they get better than that around the holidays. I am working over the holidays.
You are?
When I say working, I mean I still get the holidays off, but
let's not be ridiculous.
Hey, I'm a private practice ophthalmologist. I am working a half day on Christmas Eve. So
are you gonna go to bed early tonight to prep for that?
That's something. I have no idea. It's usually fairly sparse. Not a lot of people want to come in to get their eyes dilated.
Sure.
On New Year's Eve.
Christmas Eve.
Sorry, Christmas Eve or New Year's Eve. Because I have to work New Year's Eve as well.
But you are working a full day the day after the holiday days, right?
I don't think anybody's going to feel bad for me.
I know. I'm just saying. It's not like you have the whole week off.
I know. I took a lot of time off this year, so I'm having to make up for it now.
Right.
So, it's fine. It's usually pretty sparsely attended clinics.
Yeah.
Can you imagine what would you least like to do? What would you like to do less than getting your eyes dilated on Christmas Eve?
Put my hand on a hot stove.
You would hate that.
I would absolutely hate that.
Especially
Especially because a lot of the decorations involve lights.
Well, we also end up with a lot of that actually might make the lights look really pretty.
No, but they would be. Well, I guess most people don't have the same reaction to the dilating situation that I do. For me, it's terribly painful.
Actually, I have heard that from people. Like whenever you have cataracts or your eyes are dilated, like the lights are super sparkly and have lots of halos.
Yeah.
And it's just like a little bit of a light show. People like it.
Oh, okay.
Yeah. So maybe you should get your eyes dilated over the holidays. That's what I'm saying.
Could be a fun party trick.
All right. Let's talk about something that came up with our kid.
Yeah.
A new diagnosis I had never heard of.
Yeah. It's pretty rare, it turns out.
And actually,
she's fine. First of all,
she's fine.
There's nothing serious.
Goes nicely with the discussion we had last week about keratosis.
That's right.
About the keratosis, like hyperkeratosis
on Milo's nose.
On Milo, our dog's nose. So our 10-year-old started having these rough brown patches.
No, they were smooth.
Oh, they were smooth.
Yeah.
Okay. So these brown patches, like little quarter-sized patches on her skin, like mostly like her chest and neck. And
her face a little bit, yeah.
And we were like, what is this? I didn't know what it was.
It looked like it was under the skin, like it wasn't on top of the skin. There was nothing.
And she's had eczema before, and so we were like, could it be that? But it wasn't itchy.
Nope, didn't bother her
didn't bother at all. And it was just like these brown spots. I was like, oh, God, what is this?
Yeah.
And when I think of brown, colored spots that don't cause any problems to the patient, I think obviously my mind goes to really crazy, awful things like leukemia,
right?
And blood disorders,
right?
and then also maybe fungal infections. I thought maybe that's what it could be, is some kind of weird fungus.
Yeah.
But it wasn't raised. It wasn't itchy. It wasn't. So I was like, I don't know what this is. So I called the hotline, the nurse, the doctor hotline.
Did you know
at the clinic? I did.
Oh, you did?
Yeah.
Oh, I thought you were gonna.
I did.
Talk about when I took her to the pediatrician. You called the hotline.
I called the hotline.
You did. The advice nurse.
Yeah, the advice nurse, and talked it over. She's asking me all the questions. We were putting our heads together a little bit and trying to figure out what do we need to do here. And she said, well, I don't really know what this is, and you don't know what this is. And obviously I didn't, because I'm not a pediatrician. I don't see this stuff every day. I barely ever look at someone's neck. And so she recommended that we make an appointment. And so you took her in.
Yes.
And then take it from there. What happened?
It was like a same day or next day or something. It was quick. It was one of those that they're like, you better come in. The pediatrician went through all the same things that you just did, basically.
Yeah.
And she said, I think I know what this is. And I was like, fantastic.
She had a smirk on it, oh, I got this.
No. It was more like interesting.
Oh, okay. All right.
Which you never want to be the interesting patient, but in this case, it was okay. She tested, she's like, have you tried rubbing alcohol on these spots? And I was like, oh, no, I've tried a bunch of other stuff, but I haven't tried that. And so she got an alcohol wipe and rubbed that spot right off.
It's just like that quick.
Just came off, and you could see the brown on the alcohol wipe.
So weird.
Transferred over. It turns out it was, you may think we just don't clean our children. Au contraire.
Although we don't very often. But
they clean themselves now. So
when we remind them. Yes.
Yeah. It was Terra Firma-Forme?
Forme?
Something?
Forme?
Dermatosis.
Terra Firma-Forme Dermatosis. TFFD.
Yes.
Why don't we take a break and then we'll dive into what that is.
Okay.
Hey, Kristin.
Yeah.
I just have to talk more about Demodex blepharitis.
I'm sure you do.
I just love all things eyeballs, but not the mites this time, though.
Okay. I appreciate that. Thank you.
We're talking about collarettes.
Okay, the crusties.
Crusties. Yeah, it's kind of a cute name for Demodex blepharitis.
I guess.
Finding on exam.
Sure.
The thing is, I want to educate patients that you can't always see these things yourself.
Oh, so, and you can't feel them?
No, because they're so small. So you have to come in to see the eye doctor, either an optometrist or an ophthalmologist. We use a microscope. We can see all the collarettes on there.
Okay.
And because, it's hard for people to connect this sign on your exam with all the symptoms.
Because they can't even see it or feel it.
Right. The itchiness, the redness, the irritation that could be due to Demodex blepharitis. It's a great time now to make an appointment with your eye doctor before the end of the year and deductibles reset.
Yes.
You gotta
Very
come in.
important.
To see more pictures of crusties and eyelids with Demodex blepharitis, visit miteslovelids.com. Again, that's miteslovelids.com to learn more. This ad is brought to you by Tarsus Pharmaceuticals. All right, TFFD, Terra Firma-Forme Dermatosis. That's a mouthful, I swear. It's a rare benign skin condition characterized by well-defined, dirty-looking patches of skin that are resistant to washing with soap and water.
That's right.
And the cause is unknown, but it's believed to be related to an accumulation of keratin, a protein that forms the outer layer of your skin, and your skin folds and creases. Well, she didn't really have any lots of creases.
It wasn't in creases for her or folds. It was even on her cheeks.
But it was just extra keratin. It's
just little circles of keratin.
It wasn't like ringworm or fungus or anything. It's just like these dirty little patches that you clean off with rubbing alcohol.
Yeah, but it's not dirt. I want to be clear. It's it just looks like dirt would. Like if you had been outside and some mud had splashed on you a little bit and then dried, it kind of looked like that.
Yeah. And it's a benign condition that does not require treatment in most cases. However, if the patches are cosmetically bothersome, they can be treated with topical salicylic acid or urea creams.
See?
Right?
Just like I said last week.
Grab some bird poop off the top of your car.
Rub it on your kid.
Rub that all over your kid.
They'll love it.
Exfoliating scrubs, isopropyl alcohol wipes is what you guys did. It typically resolves on its own over time. So I guess that eventually will just
slough off or something.
Or maybe when you're just using soap and water, it'll eventually come off.
Exfoliating.
Yeah. Recurrences are possible, but it's usually mild and treated with the same measures as the original episode. It's more common in children and young adults. I've never had it. Have you?
No.
It's not contagious, and no other association between that and underlying medical conditions. That's the thing with dermatology that I find so amazed by what they're able to do. They are able to see some nondescript little thing on your skin and be like, oh, I think you have pancreatic cancer.
Exactly. Yeah.
That's insane.
How do you know?
Or like hepatitis C or there's all these weird skin manifestations.
Yeah. That to the naked eye just look like, I don't know, I got a skin bump.
That's why skin stuff is and you go on Facebook groups like doctor. We're talking Facebook groups that have thousands of doctors.
Right.
People, they're posting pictures of their kids' rash. What the hell is this? Occasionally that happens.
Yeah.
Probably more often than any other medical thing. Part of that might just be because it's easy to take a picture of a rash and show it.
Sure.
Can you guys help me out here? But I also think it's because skin stuff is hard.
Yeah.
It's hard to figure that it can look like so many different things and you have to describe it. And
yeah.
I don't know.
Also, shout out to our pediatrician because I don't think she's trained especially in dermatology in any way.
It was a general pediatrician and nailed it.
Yeah.
That's awesome.
First try.
It's awesome.
Pretty good.
I see. This is why. This is why pediatricians should make more money.
That is true. Many reasons.
Yeah. They're very good at what they do. Terra Firma.
Also, kid medical stuff is weird.
Dermatosis versus dermatitis. I guess dermatitis would be an inflammatory condition.
Yeah.
Dermatosis is just like a
pathology,
a benign skin condition that is not associated with inflammation. I guess would make it an osis versus an itis. I don't know. I'm trying to think of what oses we have in ophthalmology.
You have ptosis.
What? That's totally different.
I know. But it's right there in the name.
I'm blanking on anything that I diagnose that's an osis. I've got a lot of itises.
Yes.
See a ton of itises, but not a lot of osises.
Is it osises or OCs?
I don't know. Nothing matters.
I think it's OCs.
Who cares? All right.
Did you just say nothing matters? It's got dark.
So let's transition over to our medical topic.
Okay.
Today.
Yeah, believe it or not, that wasn't it.
No, it wasn't. That was a bonus. You guys learned about Terra Firma. I never heard of that diagnosis.
I know.
Never heard
And what
it
a weird name.
at all. All right. Let's do. All right. So I have a first aid book here,
Yes.
and we're gonna teach Kristin something, and I'm gonna teach myself something. Probably that's how this usually works out. Remember what last week's was?
I do. It was disgusting. I don't remember how to say it though.
Pemphigus vulgaris.
That's right. What was the other one?
Bullous pemphigoid.
How do you remember that so easily?
Well, the thing is, all these things, they're somewhere in my hippocampus.
I get that. That's how my whole brain works.
It's kind of sitting there.
I don't know that I remember it, but there's just like this like intuitive sense that like maybe it's this.
And then I can see the words. I'm like, oh yeah, I just can pull it out.
See, it's a free recall issue. You got to have a trigger.
Exactly. Yeah. So anyway, all right. 32 to 706. Give me something. What do you got? What do you got?
Let's do 125. Have I done that one?
Ooh, 125. You've never done anything in the 100s.
Ooh.
Oh my God. Oh.
Does it go from like what you learn at the beginning of the year through to what you learn at the end?
Not really. I mean, kind of. Like you have your like biochemistry and stuff.
Yeah,
in
like
the
foundational
front.
stuff.
So if you ever wanted to do biochemistry, we're getting in the front. What'd you say, 125?
Yeah. Microbiology.
All right. So we have basic bacteriology.
Okay.
We're going to learn about some bacteria.
Let's do it.
How's that sound? All right.
There's a lot of them.
So we got different categories here. We're going to talk about anaerobes. Do you know what anaerobes are?
Yeah, they don't use oxygen.
That's right. Anaerobes can't breathe fresh air. Believe it or not, in this book, they have that listed as a mnemonic. Anaerobes can't breathe fresh air.
What kind of mnemonic is this?
Because it's some of the examples of anaerobes include Clostridioides, Clostridium, Bacteroides, Fusobacterium, and Actinomyces.
Yeah.
CBFA. So can't breathe fresh air.
They're missing a C though. There's 2 C's there.
Well, it sounds the same. Clostridioides, Clostridium. Anyway, those are your anaerobes. So we're going to go through anaerobes.
Okay.
We're going to do intracellular bacteria. Not common.
Intracellular.
Yeah, most of the time, these are bacteria that can replicate inside the cell.
Okay.
Right? Not all bacteria can do that.
How do they usually replicate?
Just outside the cell.
Like in the membrane not in the membrane, in the liquidy stuff.
In the plasma,
stuff.
the general outside the cell liquid.
Yeah. Extracellular.
Yeah, extracellular. That's all. It's
matrix is all I can think of.
Hey, that's pretty good. Extracellular matrix. I like that. That's really great. All right, so we have your anaerobes, you got your intracellular bacteria, your encapsulated bacteria.
Yes.
Those are the hard asses.
Mm-hmm.
They're
tough guys.
Tough guys. Big old tough guys.
Those are the bouncers.
That's right. And then your urease-positive organisms. I know you're excited about that, so we'll keep that till the end. All right, let's start with anaerobes. So we already went through can't breathe fresh air. Remember them? Remember what they are?
Can they breathe dirty air?
Yeah. Probably not. Probably not. Like when Milo lets out a big one, that would kill
I don't know. They might
anaerobes.
like that.
Actually, anaerobes would they do like that.
Yeah.
You're absolutely right. Milo could hotbox a bunch of anaerobes and they just flourish. All right. So do you remember what the can't breathe fresh air? What the different? All right, I said them earlier. Do you remember any of them?
Clostridium.
Clostridium's one of them. Yep. Bacteroides.
What?
Yeah. Okay, move on.
I thought you wanted me to do both of those.
When you have Clostridium, you could probably come up with Clostridioides. It's the same thing.
Struggling, actually. Idioides is a weird thing to say.
Spell Clostridioides.
Okay. Clostridioides. I'm going to write it in crayon on this important mortgage document.
Clostridioides.
Clostridioides.
Very good. You got it.
Clostridioides.
That's almost as hard as ophthalmology right there.
It is.
All right. Then we got Bacteroides. Fusobacterium. Remember what the A is? Probably not. I just said it once.
Air?
Actinomyces.
Oh,
Goodness gracious. All right, so
we were
anaerobes.
still on the mnemonic. I'm
Here
so
we go.
confused.
Anaerobes they lack catalase and or superoxide dismutase, and thus are susceptible to oxidative damage. That's why they prefer a non-oxygen environment, because oxygen will kill them.
Yeah.
Because they don't do well. They don't have the enzymes capable of like breaking down oxygen.
Right.
And so it kills them. They're generally foul smelling.
Sure.
All right. Foul. Bad. And what causes the foul smell? Short chain fatty acids.
As opposed to long chain.
So now,
Those
you
don't smell.
can say who produced short chain fatty acids in this room. They're also very difficult to culture, anaerobes.
Oh, interesting.
Yeah, because
Because we have oxygen.
yeah, because you got to put them in a non-oxygen environment, right? So like, how do you find that in the world?
How do you find that? How do you create that?
I mean, you can create like a vacuum, I guess. I don't know. Or maybe it's probably not like no oxygen. It's probably just like a very low
small
oxygen. And so what you probably do is you just like have the room or the container be filled with more of other gases besides oxygen. So I'm not sure how they actually culture an anaerobe. Great question. Let's get some microbiologists in the comments.
Liz, where are you at?
They produce.
Oh no, she's biochemistry.
Yeah, maybe some overlap there. And they produce gas in your tissue.
Ouch.
Yeah. So you'll see that on imaging too. You can see
bubbles.
Gas production. Yeah, it just shows up on a CT scan as like black as air.
Oh.
So as nothing, just air.
Like how big of an area are we talking here?
I mean, it's just throughout your tissue, just small, like just
those little black
empty.
spots.
Yeah. I don't know how to describe in terms like the small areas. I don't know.
Look, this segment was your idea.
Let's get back on track. We're just at anaerobes. My God, we have so much more to go. Anaerobes are normal in the GI tract.
Okay, well, that explains some things.
Typically, they're pathogenic everywhere else, though. So you can have them in your GI tract, the anaerobes. You don't want them anywhere outside the GI tract.
Okay.
Aminoglycosides are an antibiotic that are effective or that are ineffective against anaerobes because these antibiotics require oxygen to enter the bacterial cell. So you don't treat anaerobes with aminoglycoside antibiotics. And what are the aminoglycoside antibiotics?
Took the words right out of my mouth.
Gentamicin. God dang it! I knew I was gonna. I thought they were just gonna come to me. What? I'm gonna kick myself once aminoglycosides.
There you go.
I'm gonna be really embarrassed by this. Gentamicin, tobramycin. Of course, tobramycin. Of course.
Of course. Everyone knows that.
Gentamicin is the most commonly used one. Tobramycin, amikacin, streptomycin, neomycin.
Bunch of
all the
mycins.
except for erythromycin is not one. That's a different one, surprisingly.
Yeah.
All right. Let's go on to intracellular bacteria, shall we?
Okay.
Yeah, let's take one more break. We'll come back and we'll finish up with intracellular bacteria, encapsulated bacteria, and your favorite, urease-positive bacteria.
Hey!
All right, intracellular bacteria. All right, here's where you get crazy.
Okay.
So these are
Hit me.
Obligate intracellular bacteria. These are bacteria that have to be inside the cell to reproduce.
Okay.
Rickettsia.
Bless you.
That's something that's found in ticks.
Ew.
Yeah, so rickettsia is like a tick-borne bacteria illness, like Rocky Mountain spotted fever.
Okay.
Chlamydia.
Ooh.
Yeah, chlamydia gets in there. And something called Coxiella. Chlamydia and Coxiella.
No comment.
They rely on the host ATP production. That's why they have to be inside the cell.
Okay. Makes sense.
So they got to use your ATP. Here's your mnemonic for obligate intracellular bacteria.
Okay.
Stay inside cells when it's really chilly and cold. Rickettsia.
These are so stupid.
Chili, chlamydia.
Does that work?
Coxiella cold. Believe it or not, it does. It does work.
None of them make much sense.
Often I would make up my own absolutely nonsensical mnemonics that would only make sense to me, but I'm the one that came up with it.
Right. You only got to remember it till the test, I guess.
Well, some of these, yeah, and now, like honestly, for like 99% of doctors, when would you ever need to know that piece of information with like off the top of your head?
Right.
Right. I mean, we can look things up very effectively now, efficiently. All right, encapsulated bacteria.
Wait. Intracellular. I have
Intracellular.
something to say about that. I've said it before on this podcast, but it makes me think of, speaking of ATP, mitochondria.
It all comes back to the mitochondria.
There is a theory that that mitochondria originated as maybe a bacteria, I don't know, some sort of other organism.
Yeah. Oh, yeah.
That got absorbed, or that got like...
I've heard that, yeah.
Yeah. Well, yeah, from me on this podcast.
Oh.
So I'm just saying.
Like evolutionarily?
Is very consistent with maybe it was an intracellular.
So maybe someday chlamydia
will just be part of our cells.
Will just be an organelle in our cells, and we will all have chlamydia.
I hope
if
not.
If enough people in this world get chlamydia, we can evolve it to have some important function in our bodies.
No, thank you.
Not worth it?
I don't
Probably
think
not.
so.
Okay, I think you're right. Encapsulated bacteria. All right, here's some examples.
Okay.
King Pseudomonas.
Ooh, your favorite.
I'm always talking about Pseudomonas.
Mm-hmm.
That's why you never submerge your head in a hot tub. You don't do it. Bad idea. That's where the Pseudomonas lies. They create biofilms. They get in the corneal stroma and they wreak havoc. I mean, they also do other things that can kill you.
How often does this happen?
Well, never in my clinic, because I'm always telling people. It doesn't matter who you are.
In the world.
You're not
how common?
I mean, it's not the most common thing, but it's common enough to where you know. I don't know how to answer that.
You harp on it
how
so
common
much.
is hot tub-induced Pseudomonas infection? Dr. Glaucomflecken, tell me, how often does that happen?
Sounds like a good knock-knock eye topic.
I don't know.
I'm just saying.
I don't know.
It is the season.
It is the season. All right. Haemophilus, H-flu. Haemophilus influenza. Have you ever heard of that?
No.
Neisseria meningitidis. Meningitis. Neisseria. We just say Neisseria.
Okay.
But Neisseria, the meningitis, the one that causes meningitis, Neisseria meningitis.
Yeah, that's the bacteria.
That's it. And encapsulate. So you're getting a theme here. It's like the really bad ones.
Yeah.
Like when bacteria's got a capsule, hard to get rid of them.
Interesting.
Salmonella, E. coli, Klebsiella, Group B strep.
Ooh.
That's the pregnancy one. You get checked for GBS. You're either GBS positive or negative.
Because I remember doing that.
Yeah, you get a test for that.
Yeah.
Their capsules, they serve as an anti-phagocytic virulence factor. So basically, it prevents some of your immune cells from eating it.
Yeah.
But it can also serve as a target for vaccines.
I was going to say, can't we just break the capsule somehow? Or whatever?
look at all of these things I just listed. How many of them have we have vaccines for?
Yeah.
We have strep.
Mm-hmm.
We have Haemophilus.
Wait, there's a strep vaccine?
Wait, is there strep?
I don't think
I'm thinking
so.
of the pneumonia vaccine.
Is it strep?
Strep pneumonia. Isn't it?
Why are you asking me? You're the one that went to med school.
God, I'm such an ophthalmologist. Dear Lord. All right. What is this? The pneumonia vaccine. What is it?
I'm pretty sure you just treat strep with antibiotics, don't you?
It's strep. Yeah. I'm right. See, you're making me second guess myself.
I'm just asking questions.
The pneumococcal conjugate vaccine is a vaccine against the bacteria Streptococcus pneumonia, which is an encapsulated bacteria.
Okay.
So
there's probably a strep throat.
No, that's
probably caused by a different.
Yeah, that's a different strep
thingy.
Exactly.
Okay.
So we're talking about strep pneumonia. H flu is a vaccine.
Mm-hmm.
We don't have one for Neisseria. I'm not aware of, and don't have one for E. coli. But there's a few though that have.
What about salmonella? Not one for that.
No. So we got a long way to go, I guess. So anyway, that's encapsulated bacteria. Bad stuff. Bad guys.
How can you?
Here's something. I say bad things about the spleen all the time.
Mhm.
All right, but here's something that if you don't have a spleen, it can be a problem because spleen are really good at removing encapsulated bacteria.
Hey, there you go.
So when you don't-
Oh my goodness. So you're ranting all the time about King Pseudomonas, and it turns out that your arch nemesis, the spleen, can get rid of
Like,
Pseudomonas.
I've known this for a long time, and I still think we should just have 2 livers instead of a liver and a spleen. Like, we'd be so much happier.
I bet you that encapsulated bacteria and whatever else the spleen does was probably a much larger problem in our evolutionary past.
Maybe. All right, let's go on to urease-positive organisms. How about that?
Okay.
All right, let's talk about urease. Urease hydrolyzes urea. This is another reason why I guess organic chemistry is important, because at some point I knew what hydrolyzing means. What it means to hydrolyze something. That's like a organic chemistry term.
Isn't it
Like remove an oxygen?
probably a
Something?
hydrogen?
Or remove like a water molecule or something. I don't know. Anyway, urease hydrolyzes urea to release ammonia and carbon dioxide. And what that does is it increases the pH. So that's what urease does. Increases pH.
Wait, is this a...
So these are organisms that have urease.
Okay.
All right.
So wait,
I'm just telling you what urease does.
hold on. Urease is an enzyme?
Yes.
And it is related to bacteria in what way?
It's just some bacteria that have this enzyme in it.
Okay, so the bacteria contain this enzyme.
Contain this enzyme that releases ammonia and carbon dioxide and thereby increases your pH. All right. So you see this a lot in like urinary tract infections. Okay. It predisposes to like certain types of stones you can get in your urinary tract.
Yeah.
Like urine stones, bladder stones. So like Proteus, Cryptococcus, H. pylori, urea plasma, nocardia, Klebsiella, strep epidermidis, staph saprophyticus.
Uh-oh.
So all of those, they came up with a mnemonic for. Can you guess what it is?
No, there's no possible way because it's going to be nonsense.
That's actually pretty good. The mnemonic is P chunks. Because there's like stones.
Of the stones,
involved.
yeah.
P chunks.
Okay, I get on board with that one.
That's a
that
good
one is
one.
at least related to the thing you're trying to remember.
P chunks. Urease positive organisms.
That's funny.
I can't tell you. I don't even think I was ever even tested on that. Totally useless information
There you go.
for me, personally.
Hydrolyze means to break down a compound with water.
Okay, yeah. And it's hydro. Obviously, that makes sense.
And then lies.
Oh, so break down with water.
Yes.
Okay, so use water. So urease uses water to break down urea into ammonia and carbon dioxide.
Not things you tend to want in your body, those two.
I wouldn't think so. No.
Well, carbon dioxide?
Yeah, you got to blow that stuff off. You get rid of that. Get rid of that nonsense.
Yes.
All right. That's our topic. Looks like we missed our producers.
The spleen is a vital organ that plays a crucial role.
Right. Vital is subjective.
Oh no.
Vital is subjective.
It plays a crucial role in filtering the blood, storing blood, producing blood cells, regulating the immune system, and maintaining fluid balance. That sounds important.
Sounds like propaganda to me.
Oh my goodness.
All right.
What do you have against the spleen?
Let us know what you thought of our topic for today. Fact check us. Let us know what you think of the spleen and why it sucks. And anything else you want to add to our discussion for today. We'd love to hear from actual experts too, or people that just know us more than we do.
Yeah. Not hard to do on this
topic.
Email
us, knockknocki@human-content.com. You can visit us on our social media platforms. Hang out with us and the Human Content Podcast family on Instagram and TikTok @Human Content Pods. Thank you to all the great listeners leaving feedback and reviews. If you subscribe and comment on your favorite podcasting app or on YouTube, we can give you a shout out. Like today, we have @FreeMovies411 on YouTube said, thank you for the podcast. It is enjoyable.
Thank you.
We appreciate that. Full video episodes are up every week on our YouTube channel @Glauc and Pleckins. Go leave a comment over there, by the way. We love seeing those. That helps us know what we got wrong in these episodes. And what we get right. Occasionally we get stuff right too.
And what you want to see or don't
Exactly.
want to see.
We also have a Patreon. Lots of cool perks, bonus episodes, react to medical shows and movies. Hang out with other members of the Knock Knock High community. Early ad-free episode access to interactive Q&A live stream events. Much more. Patreon.com/Glauc and Pleckins or go to glaucandpleckins.com. Speaking of Patreon community perks, shout out to the Jonathans as usual. Patrick, Lucia C, Edward K, Marion W, Mr. Granddaddy, Caitlin C, Brianna L, MP Cole, Mary H, Keith G. That sounds like a famous, like a some kind of pop artist, some musician. MP Cole. It sounds like it just rolls off the tongue.
Oh yeah.
MP Cole.
That'd be a good
like
stage name.
Yeah, it'd be a great stage name. Mary H, Keith G, Parker, Muhammad L, David H, Kaylee A, Gabe, Gary M, Eric B, Marlene S, Scott M, Kelsey M, Dr. Hoover, Sean M, Ryan N, Jess K, Hawkeye MD, Bubbly Salt, and
Shiny D.
Patreon roulette time. Random shout out to someone in the emergency medicine tier. Shout out to Claudia H for being a patron. Hi, Claudia. Thank you. And thank you all for listening. We're your hosts, Will and Kristin Flannery, also known as the Glauc and Pleckins. Our executive producers are Will Flannery, Kristin Flannery, Aaron Corney, Rob Gilman, and Shanti Brooker. Editor, engineer, Jason Portiza. Our music is by Omer Binsby. To learn about our Knock Knock Highs program disclaimer and ethics policy submission verification licensing terms and HIPAA release terms, go to glaucandpleckins.com or reach out to us knockknockhigh@human-content.com with any questions, concerns, or fun medical puns. Knock Knock High is a human content production.
In summary, the spleen is a vital organ that plays a crucial role in filtering the blood, storing blood, producing blood cells, regulating the immune system, and maintaining fluid balance.
End episode.
Knock, knock, goodbye.
Hey, Kristin.
Yeah.
Let me tell you something.
Okay.
You know what physicians are always telling me about?
How gross eyeballs are?
No, actually how wonderful ophthalmology is as a specialty.
Okay.
But also how sick of documenting they are.
Oh, yes. That
Because
has gotten out of hand.
It's gotten just too much to document now.
That's right.
Which is why I really love what Microsoft Dragon Copilot is doing.
Yes.
Using AI assistant to just help the physician.
Yeah, take some tasks off your plate. Save
Completing
your
all.
time.
Yeah, and there's new levels of customization available using Microsoft Dragon Copilot. You can capture multi-party conversations. You can convert conversations into specialty-specific notes. Get notes delivered to the EHR for review and editing. It's all right there for you.
Love it.
It's great and helps to automate tasks, surfacing information. Just lets you focus on the patient-physician relationship. It's what it's all about. So to learn more about Microsoft Dragon Copilot, visit aka.ms/knockknockhigh. Again, that's aka.ms/knockknockhigh. Thanks for watching the episode. You can find more on that playlist over there. If you prefer to listen or you just had your eyes dilated, you can binge full episodes wherever you get your podcasts. Or join the party over on Patreon, where you get early access episodes, hang out with us, get lots of exclusive bonus content. Hope you subscribe, leave a comment below. Let us know what you think.